How can you stick to bladder health diets long term? Sticking to a bladder health diet over the long haul can feel challenging, but with the right strategies, it can become a natural part of your lifestyle. First, it's important to understand what a bladder health diet entails. This type of diet focuses on reducing bladder irritants and promoting foods that support overall bladder function. Key irritants to limit include caffeine, alcohol, carbonated beverages, chocolate, and spicy or acidic foods. These items can heighten bladder sensitivity and urgency. Balancing your fluid intake is also crucial. Aim to drink plenty of fluids during the day, especially in the morning and afternoon, while cutting back a few hours before bedtime to minimize nighttime trips to the bathroom. Embracing a healthy eating pattern, such as the Mediterranean diet, can also be beneficial. This diet emphasizes fruits, vegetables, whole grains, lean proteins, and healthy fats while limiting processed foods and saturated fats. Such a balanced approach not only supports bladder health but may also lower the risk of bladder cancer. To maintain these dietary habits over time, consider these practical steps. First, make gradual modifications to your diet. Instead of cutting out favorite foods all at once, slowly reduce your intake of bladder irritants. This allows your body to adjust and helps you identify which foods impact your bladder the most. Next, keep a food and symptom diary. Tracking what you eat and how it affects your bladder can help you tailor your diet to your specific needs. This personalized approach can prevent unnecessary restrictions and make it easier to stick to your diet. Meal planning is another effective strategy. By planning your meals in advance, you can ensure that you include bladder-friendly foods and avoid impulsive choices that might include irritants. Incorporating fiber-rich foods can also help improve bowel function, which indirectly supports bladder health. Hydration management is key as well. Drink enough fluids to avoid concentrated urine, which can irritate the bladder. However, be mindful not to overdo it, especially in the evening, to reduce urgency and nighttime bathroom visits. Consider seeking behavioral support from healthcare providers or dietitians who can offer guidance and encouragement. Joining support groups or bladder health programs can also help keep you motivated. Flexibility is important too. Allow yourself the occasional indulgence in less bladder-friendly foods, but do so in moderation. This can help prevent feelings of deprivation that might lead to giving up on your dietary goals. Lastly, stay informed about the connection between diet and bladder health. Understanding how certain foods can influence bladder cancer risk and urinary symptoms can empower you to make better choices. For those with bladder cancer or at risk, following these dietary principles can complement medical treatments and enhance quality of life. However, remember that dietary changes should always be personalized and discussed with healthcare professionals. By focusing on gradual changes, balanced nutrition, and seeking support, sticking to a bladder health diet can become a sustainable part of your life.